Good times.
Awesome. Hey, thank you so much for joining us again. After our previous video, we got a lot of feedback, and some of it has been incredibly interesting because it basically shows we've been lied to by the government. And this is the government, by the way, that is our sole source of truth. And so we're going to get to that very, very shortly. Some interesting letters and official information letters that Chantel's received just yesterday. But before we do, I just want to say, look, if you want to get the vaccine, you go for it. It's absolutely your choice, and we're not taking that choice away from anyone. But if you don't want it, that should be your choice as well. Because I think what we're really seeing in the evidence right around the world, particularly if you look at Israel and Iceland and places like that, is the vaccine simply reduces your symptoms. It does not stop you catching COVID. It does not stop you passing on COVID. And unfortunately, it doesn't stop you dying from it. So if you want reduced symptoms, absolutely get the vaccine, but it is not a silver bullet. It is not a cure for COVID-19. That's really, really important, but we're not stopping you getting it. We just want to have an open debate. And unfortunately, New Zealand, too many people have been shut down and taken off Facebook and deplatformed when actually that is what open debate is about. So I'll just put it out there. If you want it, you go for it. We're not saying that. We're also not telling you what's in the vaccine because we don't know. We're not doctors or scientists. So we're not telling you what's in it. We're just giving you stats that you are freely able to find on public websites and generally on the government websites like the CDC, which is Centre for Disease Control in the States, or the English one, or New Zealand. So all the data is available. It's up to you to research it. We're not telling you what's in it, although interestingly enough, because the FDA in America have now said Pfizer is legal to go to everyone, Pfizer now have to give them a list of all the contents. They didn't have to before. Under emergency use, they didn't have to. Now, under approval, they do. So within the next 14 days, Pfizer has to give all the contents, as well as giving samples to be tested to the FDA. So if you want to know what's in it, you'll find out soon. Then you don't have to worry about the rumour mills. How's that? Good score. But meantime, let's go to what actually happened and what we got feedback on. I mean, I got a letter from a trainee nurse who has only got one more section, and then she's fully qualified, which is great. We need nurses. But she's been told she cannot go to the next section unless she's vaccinated. And again, why are we forcing this vaccine on people when all it does is reduce your own symptoms? I don't think it's right and unfair on her because she does not feel she has a choice. That's not the big news story though. Chantel, you got a really interesting letter and some official information that you want to share with us. Tell us about it. What happened?
Awesome. So there's been a massive response, as you said, and some of the stuff that I've been sent has been absolutely fascinating. What we're going to talk about is how the government have misled us into the number of deaths here in New Zealand. I have Official Information Act requests that show the true number of deaths, show comorbidities, everything like that. All of these are found on government websites. I'll post the links below. You'll be able to find them on MedSafe Yourself, the Official Information Act, and who signed them off, which was Natalie Richardson, COVID-19 director here in New Zealand. So I'm quoting her own words. It's official request. Let's get stuck into it. So I'll read out loud part of the letter, the questions that were asked, so you guys know the exact responses that were given. So it's not coming out of my mouth, it's from the horses. Out of the people, this was dated the 30th of July 2020, by the way. So some of the deaths that we've had since then aren't included in these numbers because of that fact. So 30th of July 2020, it was a response to an official request for information. Out of the people who have died of COVID-19 in New Zealand, how many have tested positive for COVID-19? Pretty important thing to know, right? If you're going to spend billions of dollars. Out of the people who have died of COVID-19 in New Zealand and not tested positive, please advise if they received a negative test or were never tested. Out of the people who died of COVID-19 and tested positive, can you please list their ages and other comorbidities? Please confirm the total COVID-19 deaths as at the date you provide this information. So the first response, out of the people who've died of COVID-19, how many have tested positive for COVID-19? Of the 22 deaths, only 17 tested positive. It's nearly 20%.
So five hadn't been tested positive.
5 did not test positive. 4 of them were tested negative, and 1 of them wasn't even tested at all. So you have
4 people that tested, they didn't have something, died of it.
Yep. Isn't that amazing? What an amazing achievement in medicine that it's 2021 and you can die of something that you tested negative for. How? or you were never tested for. Oh, you died of cancer. I can just see it in your eyes. I mean, I couldn't think of anything more misleading than that, to tell someone they died of something they never tested positive for, or they didn't even get tested for at all. And it said the case definitions are publicly available on the ministry website. That link's no longer active, so we can't actually determine what that case definition looks like at the time that this was written. So it says there's another note in this, which people will be able to read. For context, 2 of the 4 tested negative before becoming a confirmed case and were not tested again after being reported as a probable case. What does that confirmed mean if they didn't test positive? So they're a confirmed case, even though they didn't test positive, they tested negative, and they were not tested again after being reported as probable. So how does that work? How does that work? Okay, so out of the 17 that did test positive, 8 had underlying conditions. That's 9 people who died that didn't have underlying conditions that we've spent $77 billion on so far.
We haven't spent it on them, have we? We've spent that trying to prevent more deaths, and I get that.
Yeah.
But the problem is the motivation to spend the $77 billion is those deaths, and those deaths aren't accurate. And unfortunately, within that time, we have had thousands of deaths from cancer, hundreds of deaths from heart attack, and yet for those misreported deaths, we've spent $77 billion, and unfortunately, we're not out of it. In fact, the latest wave shows we're just starting all over again, and we haven't got another $77 billion. So it's pretty well what we were saying last year, is you can't continue spending money to stop something you can't stop. And I think this is more evidence of it. Carry on, Chantal. You got a letter accompanying that from a lady in Woodend.
So that was the letter from the lady in Woodend. There's another letter here dated the 18th of June 2020. Just carrying on from what Dad said as well, that's addressed in our previous video. So if you were to get worried and think, okay, well, what if it runs rampant? What does that look like? We live very similar lifestyles. Our cases of recording, which seems very excessive for this disease, is all, we speak about that in our last video. So you can go through that and analyze, okay, if it did run rampant in New Zealand, what's a country that's similar? What does their data look like? I know people talk about India, level of healthcare is a lot lower, population's huge compared to us. So I think just look at countries that are really, really comparative in terms of lifestyle, dietary choices, everything like that. This second letter, dated 18th of June 2020. This again asks very similar information to the first one, so I won't go by that. But there's one part in here that I found fascinating. When you look at the world data and our data, and it is this one question. Is it protocol to remove any negative tested patients from the COVID stats, or do they stay as probable even if tested negative? The response to that, dramatic pause because I have to click into the next part of the letter. So, no, it is not protocol. Patients who test negative for COVID-19 but still displayed symptoms remained as probable cases provided they met the case definition. So, and this next part. So that first part is fascinating. They do not remove them even if they know that they've tested negative. So you could have died from anything else and they think it was COVID and they're going to say it's COVID regardless of any test. The second part, are the negative tested COVID deaths reported to the World Health Organization? That question in itself reflects back to every other country that could be doing exactly this, exactly the same thing, reporting negative deaths to the World Health Organization, thereby hugely inflating our death numbers. The answer to that question, yes, deceased individuals who are considered probable cases with negative test results are reported to the World Health Organization.
Okay.
I don't know about you. It blew my mind.
So the scary thing is the question we have to ask ourselves is a pandemic. And reality is, I'd just challenge you yourselves, go and have a look. Have a look at world stats and places like that. Is the population of the world decreasing or increasing, or is it at a similar rate? You know, what is actually going on? I went on the CDC website and looked at the deaths from COVID, and then looked at the comorbidities, and it was interesting that when you took all the comorbidities out, there's a tiny percentage that had no comorbidities that had died from COVID. But, you know, that's just what I saw when I looked at it. You have a look yourself. It's all available there. World Stats, I think, is quite an interesting one. And that shows too that we've got a lot more people dying of hunger in the world today than we have of COVID. And the amount of money we've spent in COVID in New Zealand probably could have solved world hunger for at least a year. So, there's bigger issues that we're ignoring. We're sort of missing a whole lot of the stuff that's going on. And I think Scott Morrison's probably got it a bit right. We've got to learn to live with this disease. One of the things we can use to live with it is a product called ivermectin, and it was spoken about earlier and discarded. In fact, we had access removed off the shelves for ivermectin. Yet ivermectin actually won the Nobel Prize in 2015. Okay, so it's been around since, I think it was 1980, been around for 40 years. 2015, it won the Nobel Prize. So it's not a snake oil. It's been used right across the world really effectively. And there's metadata stats and studies now show that it's effective in treating COVID. And you Google it, you find out. It's no good me giving it all to you. Go and find it yourself. But there's studies right around the world that show it works. And yet we are actually restricted access from it. I think that's wrong. Because if we decide, like I've decided, I'm not going to get the jab, I don't really want it. I'm going to take vitamin D and vitamin C, and I'd take ivermectin if I could get it, if I started feeling sick, because I'd rather do that and get the virus myself and actually build up antibodies than actually get the jab. And that's my choice. I should be allowed that choice. I'm in my 50s. I should be allowed to choose what I put in my body, surely. And it just seems bizarre that the government has said we cannot have this drug that treats it. One of the arguments for giving licenses to the vaccine makers without full testing was there was no other treatment. That was one of the reasons. And yet there is other treatment and we've been told we can't have it. To me, that's wrong. That is just not right. So I'm totally against that because I think that's misinformation. And yeah, ivermectin, have a look at it. Won the Nobel Prize in 2015. Brilliant. Yeah. So over to you.
All right. So is there anything left that we want to talk about?
Yeah. So the other thing I really does question, so we're talking, is the government actually telling us the whole truth? And I'm really concerned that they're not telling us the whole truth. And one of my other concerns is the fact that we've got a Prime Minister with 78 PR working for her. Do you need 78 people full time if you're just telling the truth? I don't get that. I mean, what are they actually putting together? Are they telling you every word to say, every sentence, every raise of the eyebrows, every look to the side, every smile? 78 people, you'd think they'd have to. It just seems bizarre that we cannot have an open discussion on this whole issue. I mean, I would love to see doctors from both sides sitting down discussing, debating it. That's almost television I'd watch. Definitely better than Parliament TV. But why can't we hear all the ideas? So look, sorry, I'm getting notes here. Actually, it looks like I've got a grandchild with a broken arm, so I'm going to head off. And lovely to see you, Chantel, and have a good afternoon.
Thanks, everyone. Thank you so much for everyone supporting us and sending us such kind and supportive messages. It's far and few between these days, and we do really appreciate it. He's running off. Thanks so much.